Hi, hello everyone. Very nice to see everyone joining today's talks, and thank you for your time and your understanding for the issues we've been faced with to moving this seminar from noon time to 2 p.m. Today's talk is going to be about the decision making as a democratic site. It's going to be more about exploring the journey on how we understand community identities in order to create the informed decision making based on the real needs and actually the broader context of the communities we work with. And the this webinar is actually based on the research I work currently on, which is exploring the postponement of the decisions in environmental protection that actually leads to increase in the vulnerability of young populations. So I wanted to just to see how these political decisions and commitments are important in order to create the sustainable and safe place for those coming after us. We're going to be speaking more about the context of how we use scientific data in order to create the advocacy that actually leads to informed decision making, and also to see how we actually frame those community needs in a broader context as we understand it as an identity. We have no like definition of the community identity for today's talk, but basically Vlatka and I have spoken a lot about how we do create that space that we want to bring more information and understanding how or on what the communities are faced. My today's guest is my friend and my colleague Vlatka Matković, who holds a PhD in biomedicine and health science. Vlatka has did a lot research work when it comes to public health and environmental health. We also been working together on many issues when it comes to environmental health. She did a lot of on better understanding the environmental risks and how they actually shape the future and shape the communities. She worked about like a decade as an EU policy scientific officer at the Health Environment Alliance, Brussels-based organization that has worked on environmental health across the Europe and I would say globally. She also has contributed to a joint research center working on burden disease attributed to air pollution across the Western Balkan countries, which was absolutely amazing work because they have created a really comprehensive and important document for the region, which helped many of us actually to reference to and actually to advocate for the better environmental conditions. And also she serves as a EU project manager at the Lung Europe. Vlatka, welcome to today's talk. I'm really happy to see you again and having this opportunity talking to you about the things you have worked on for so long.
Thank you very much for really nice words. You can go for a job interview with me instead of me. And I'm happy that, yeah, to be here with you and discuss these topics that are not maybe that need a little bit of thinking when discussing.
Yes, actually, we never actually talked about the community identity, but so let me just kick this conversation with a very simple question on when we say like community identity in policy work, how do you define it in a way that stay close to the live experience, but also it's used and or being usable inside the institutions and decision making frameworks.
Sorry, I think I had some break in my connection. Could you repeat?
Yeah, so my question was like, how do you see this community identity as a framework? How do you see that at the same time as a living experience, but also something that can be usable for advocacy and policy making?
Yeah. So from my experience, I mean, identity as something that group of people will join together is extremely powerful in any kind of advocacy and lobby towards public health, for example, cleaner air advocacy push. People gather in different kind of groups, so it can be like more, I would say, loose identity. For example, identifying as a group who would rather live in a clean environment than polluted environment. But there are other kind of identities that can be brought here. For example, what I see, I'm living and working in Brussels in Belgium. So for here we had quite a bit of work around low emission zones and really restricting city center to cars, to vehicles. And then it appeared completely something different as identity. People started to one group of people started to identify as car users. Car users is usually not an identity, right? You are using your car, you are not thinking about this. But they started to see themselves as a group of people who are brought together to defend being able to enter into the city center with polluted car, very old and polluting cars, and they start to advocate for their rights. And then on the other hand, for example, you had an identity created together that brought communities together, parents of children. So this is like you are a parent of children. It's not really your identity. You're not belonging to a group of people, but you are starting to develop this identity. Okay, we want to collect, we want to collectively bring this power as parents of kids and really like gather around, for example, schools and protect these areas for cleaner air for our kids. So this is how the identity started to appear as a parent of like related to a school, a parent. And they started as well to have their own advocacy pushes, for example, for, again, air quality in not just in Brussels, obviously, but in many other places as well. So just as the two examples that probably you have in your environments where people started to gather around, the identity appeared, not necessarily like before this need of advocating, it appeared as something that started to bring communities together. Was this clear?
Yeah, it was clear. And actually, thank you for mentioning those, I would say, hidden identities we actually not faced to every day, especially as many in this new age it actually pops up everywhere. So basically, we see that, even for example, the digital space is actually creating a lot of, power around those group of people, and, those identities are really becoming more visible, and also brings a lot to advocacy work, which actually leads to the decision making. So speaking about that, about everything you have said, like I'm just wondering, like speaking about your previous experience, what do you see, as a strong evidence, or being enough as a strong evidence to advocate for something? Like what could be like those the elements of the identity that you can use to create a narrative on a broader context of that identity in order to advocate for something? Because I know that you have worked a lot, for example, with the EU Commission, advocating for the better health of different communities when it comes to their lives, and them being exposed to environmental risks. So what do you see as a strong evidence? And especially speaking about, we are talking about the science here today, and what are the kind of information you need in order to advocate for something? What is strong evidence for in that context?
Yeah, in advocacy, especially on high political levels, definitely the strongest evidence is scientifically based evidence. So anything that you can contribute with evidence, for example, from air monitor for air pollution, or any kind of health impact assessments where you are assessing how certain intervention, that being whatever, it can be from therapy, it can be from implemented legislation, how this would affect later on health of people. Would health of people then be better and how much, and to which extent, of course, like what would be what would be better. So I would definitely go for scientific evidence as a first thing. That also political authority would be hearing, and then next to it is for sure monetizing this. So everything that you have as a better outcome of certain policy could be potentially monetized. Like better health, there is a monetization in it. If you are avoiding death, this can be monetized. If you are avoiding not having 3 asthma attacks a year, this definitely have a price. If you are avoiding having I don't know, a worse cardiovascular health, there is also very, very clear price tag to that. So yeah, decision makers like to see this money in any kind of evidence, because this is how they translate things. Like they are then looking at your evidence and your kind of savings, let's call them like this, in comparison to other budget lines that they are having. So I think the monetization is one of the strongest. If we could come up with this kind of things of monetization, that would be very strong evidence. But there are other things like that would be just creating a pressure on political level, like even without very clear evidence. But then, of course, it needs to be a strong, very strong and big group that will be creating this pressure.
Just by saying the last sentence, actually, you reminded me of the case that we work together, and when it comes to air pollution, as you also mentioned here, when the Republic of Serbia has started creating the first program on air protection, and I remember that the government, actually, who was the Ministry of Environment, who was responsible for creating that document, has started to avoiding the momentum of actually including the health data when it comes to attributed air pollution. And I remember that we have spent about, I guess it was about 2 years advocating or telling them constantly that those data has to be integrated into the document, and we actually make that happen. Which was really good, because I guess it gave us another momentum of using that document for further advocacy and actually going beyond those facts that has been mentioned in this document, actually creating the better and the bigger framework for actually implementing the activities that has led to helping people reduce the risks, health risks.
Any kind of policy change comes with a lot of effort. It's not just a very easy thing to do, but it's worthwhile, because once it becomes business as usual, then it really stays over there, and it's really hard to overlook this kind of evidence. And for any kind of really public good, you have to have this effort then from communities that are affected negatively by certain other, I don't know, practices. So what we like to say is like polluter should pay. So those people they cannot make profit just by exporting pollution to people, and then people have to deal with this pollution, like effects of the pollution. So polluter should be the one who should be investing in better cars with like electric cars, or I don't know, if it's coal power plant, it should be either closed or looking to close, if not installing the filters that will reduce the pollution, and so on. So there are many actions that can be done also in other fields, not just we are speaking here as an example for air pollution, but there are many others that probably can be translated.
I guess that speaking about the health risks by default brings us to the topic of vulnerability. So as you also have worked with different kind of vulnerable populations and different health risks they've been exposed to, I was always wondering, how it's actually challenging to work with the communities as they've been going through all of these difficulties and being faced with, the issues, the health issues, and also at the same time using that vulnerability as, I guess, the most strongest advocacy agency to actually advocate for better health and to for the better measures that actually created the safe and sustainable future. So I just want to hear more from you about like how do you understand that those vulnerabilities and how you see that as a something that it can be used as a strong tool to advocate for solving the problems.
Yeah, so vulnerabilities, people who are vulnerable very often also have less voice. So, for example, children or pregnant women or elderly people in this particular case of air pollution, they are more susceptible for effects of air pollution, but they usually do not have advocating body who will really like voice their concerns. That's one thing. But then on the other hand, I think most of us do understand, or I don't know, emotionally are connected to those identities, right? To children, for example. So we would go a step forward in any kind of our action for protection of kids. So that could be a strong momentum then in advocating for a cause if we really bring together vulnerability and see how they are experiencing effects. Yeah.
Do you see, like, as you've been talking, I was thinking, like, do you see that some vulnerabilities have been taken seriously and the others not? Like, as you mentioned, for example, that we have this, emotional attachment to the children, for example, and we can always be, bringing that topic to the advocacy arena and being meeting with those in power. Do you think that they will better react to the, things that you want to talk about the children comparing to, I don't know, people living with certain health conditions?
Yeah, definitely. I mean, this plays on this identity, for example. I would say um, it can be both ways, obviously. Like children, most of us would be like more emotionally attached to this idea of protecting children. But do we have the same kind of idea and will to protect, for example, Roma population in reality, not like speeching, like preaching about it? Do we have the same kind of really wish to protect pregnant women? Probably yes, but then when it comes to elderly, only those who have, I don't know, elderly parents or facing with certain problems that this group is faced with. Um, yeah, so I would say it can be quite diverse. It takes a lot of awareness. Um, I don't know. Do you have anything to add to this? I'm sure that others also have similar
Yeah, I
experiences.
mean, I absolutely do have, as we both have worked with different vulnerable populations in the past, and I worked on HIV and AIDS and tuberculosis, which actually bring completely different contexts comparing to the environmental risks and
Yes.
different, environmental vulnerable populations. Basically, as we've been breathing, we all have been exposed to the air pollution, for example. But of course, that we understand that vulnerability belongs to those with pre-health conditions that we advocate for, improving the quality of air in order to really create the places where those people can live without going through such a suffering. And we do have, for example, we often do speak in the context of elderly people and with cardiovascular diseases, but also we have those children. And the science has taught us that, unfortunately, the air pollution, as we're speaking about this example, that air pollution actually also influences the dementia, for example, the mental health, anxiety, and many other things, which is something that I see in policy and decision-making areas not taken seriously yet, as we have, I guess, not the strong narrative in the public spaces where we actually are speaking seriously that, for example, that breathing air pollution do affect the young generations and make them feel, bad or going through anxiety. I have recently spoken to one young man from Bosnia and Herzegovina who lives in Sarajevo. He's a student, and he has told me that, for example, he has the feeling that air pollution affects his mental health. He's staying, indoors a lot. He talks about his friends a lot about how that affects his mental health. So it is always like really hard to understand like what those people are going through in order to get this identity, which is like absolutely the broader context of the policy making. And one of, I guess, the most important thing here is that we're always looking to inform decision making, which means that we do consider science, we do consider the living experience, we do consider the voices of communities. We actually have, we need to have this, like open space. We actually take into account everything that is related to that. The funds, the money that you have mentioned, which is also the most important thing, because speaking the West Balkan region, we do create these policies, laws and bylaws, we create the strategies, but we actually do not put much that effort into the putting enough money and the funds into, those plans. So we actually implement those measures in order to create, the better world for all. So yeah, the topic of the vulnerability is very important, and I think it's always something that is, you know, very sensitive to talk to, because and yeah, and the another thing is very important when creating these policies. I really do advocate for the momentum that we need to have the representative of these, vulnerable populations on any other groups. So actually, they actually sit at the same table with those creating the policies and making the decisions. So actually, they can really hear from them, like what are the needs, what they need to, to do in order to make their life easier. So it's very yeah, it is just very important to have that's like the platforms where all of these people are engaged with in order to really precisely create those policies. Um,
Yeah, I would totally support this. I mean, this is really a good practice in any kind of decision making, to have a platform where you will engage, really engage those people who this will affect. Otherwise, policies are right, how do you say, top down. And yeah, few brains from top are thinking and trying to figure out what actually would make sense on the ground, which can be completely not true. So there needs to be this feed and loop when creating any kind of policies and strategies. I have a nice example also from Brussels. Sorry for it's all from Brussels, but this is where I live, and I'm engaged not like professionally, but really as a community member, as a citizen. So when there was a climate strategy, really the municipality was inviting people from municipality to join and together to create actions. So we were going through not, okay, it was a strategic document, but we were going, okay, what we can do? Can we maybe municipality pay a little bit for heat pumps so that people can switch from heating on wood to heat pumps, or polluting less, of course, and then the CO2 of the municipality would also come down. Can we do a little bit of more other actions, and what people want to do? Like, do they want to plant a tree? Do they want to do some kind of investment in insulation. Like there are totally different kinds of policy implementation tools, right? Like, so you would invest money in trees, but people want insulation. So why would somebody on top decide, okay, let's invest in I don't know, planting trees? I'm just saying one of the examples, but so listening to people and what they want is definitely something that's really good practice. I think in Serbia you also had a little bit of that momentum in replacing the like old polluting stoves with something a little bit less polluting, right? Where really citizens were involved in creating what kind of policy measures will be put in place. So that's yeah, absolutely needed.
And what do you think when, for example, any of vulnerability of identities are actually or become the part of the official document or strategy or law by law? Do you see that when accepted that the behaviors of those in power or decision makers is changed? Do you see them like really considering the fact that they have something they need to also advocate for and work on more than before? And do they like behave differently? Do they use these public spaces to raise the voices of those being under the risk, or like just putting more effort in order to increase the visibility of that, let's say, vulnerability of or in
I will not speak for all of the countries, but so disclaimer, but yes, I think yes, as soon as you start to change the narrative in policies, this also becomes a narrative, wider narrative. So if you can get this awareness in some kind of documents like strategic and policy documents, it will increase awareness also on politician level and like in general decision making process. So I would say absolutely yes.
And as we're speaking, you and me right now, and also people joining the call, I guess that we are more knowledgeable about some certain things, and we have like this knowledge how to do something, or we learned how to, perform in certain way. I was thinking like, as you're at the call with us today, like how much is important to have like the experts, people with the knowledge and experience in a certain field actually at the table to actually create these policies in a right way, and also help those under the risk actually to deliver the message, because we know that across the globe there is a lot. I mean, as you mentioned, also in Brussels there is a communities where just the citizens have created those groups and they wanted to advocate for something, but unfortunately they have no like scientific or just that kind of knowledge, the level of knowledge they need to advocate and to talk to those in power or decision making.
One goes together with the other. So science itself cannot solve problems, same as like well, advocacy maybe yes, like groups themselves. But this is super important to have like experts on board who can, first of all, bring awareness and say why this is, I don't know, let's say what kind of health impacts are produced by certain levels of air pollution. So experts can bring this knowledge that will then later on be translated to a little bit of lay language, so language that others, like everybody, will understand, so that as well this can come into the policy, that measures can be created or demanded from these community groups. So I think it goes, one goes together with the other.
Yeah, I completely agree with that. And as you mentioned that, I was thinking um, how communication is important. Like when we always speaking about the policy making, decision making as something very big, but I remember when we have work on one big report, there was like the person from communication, and she said like, I know or I do understand that you're like speaking about the science evidence, and it's very important. But my job is actually to bring that to the light. Actually, I need to, create the messages around those demands. I need to go out and say loud, like, you want this and that. Because I remember that we were stuck into like, doing the research and, doing the analysis, and we got those data. So now we have the evidence, but we said like we have numbers, we have like, some, but we didn't know what to do at that time, And she just reminded me of the fact how important it is actually to um, communicate those data in the right way so everyone can understand the broader audience, no matter how, you know, or on what you're working on, like it's like the health or energy or environment, whatever you're going to speak about to public, it has to be very understandable to everyone. But when it comes to policy making and decision making, this targeted communication is a very important part of that journey. And how do you see, I mean, what is your like experience when, since you have worked a lot of research and scientific like, jobs before, like how do you see that as a challenge when it comes to creating the space for delivering that message?
You are completely right. So, as a scientist, like we tend to go into very deep, nitty-gritty details of things, numbers that are completely untranslatable. But communication of this, or rather, like translation to something actionable, translation to something that people could take, like really absorb this knowledge, is something completely different. Um, I have similar experience with same as you. I mean, I like to work with people who are really in communication. So in a sense, they can translate these messages. So if I'm saying like, okay, there is a X amount of preventable deaths in this town if we implement this and this policy, that's like, okay, it's really hard to understand, but we could say differently, like air pollution is making you sick. So this is a very simple message. It has like 5 words in it, and everybody's can understand it. So where you are walking on your city, you can see, oh, I really feel it now, like I'm aware of it now, and I wanna actually ask my policymaker in my city, why is he not doing anything about it? So this is like call to action in a sense, right? So I don't need to know how many exactly deaths are prevented or not prevented, or people have asthma. This knowledge I don't need to exactly know, but I need to know overall overarching message from it to take action, like my own action, what I'm interested in. I'm interested in air pollution, but somebody else might be interested in something else. I don't know, human rights or animal rights. I don't know, something else that will be important for them.
Yeah, I see that because I see that almost every day because I have been working on different issues throughout the time, and it's always hard to actually, excuse me, to create those messages, targeted communication, actually to deliver that message to those who making the decisions. But one of the other issues that I see in this like decision making as a democratic science, as we said at the beginning, is actually that we are also flooded by the different data at the same time. And we are producing enormous amount of the reports and delivering those findings to the public. So basically, I see that, for example, if we're speaking about the broader context, the general audience, like the general population, is quite of confused or overloaded by this information. So basically, their interest in like engaging with a certain topics are not the same as it was like many years ago. And I see that, for example, in our case, where we are producing a lot of reports annually, we actually started thinking of reducing the number of the pages and actually making simplify, I mean, just to simplify the narrative, and also putting more infographics in order comparing to, the plain text as we had before. So I see that, it is very important also to understand the broader context that we work in, because I mean, if we decided to be one in charge of speaking on behalf of the communities and, and speaking about the context of identity, we really need to understand like what is going on with the world around us, and to see like what is the reality we are faced with, because I'm sure that, it is but just by understanding how this digital world is going so fast every day, and no matter how we could say like, well, I'm gonna catch up with that, but the fact is that you really need to sit and learn about that. So basically, it's just another effort and the time that you need to put in order to create something very, you know, like create the level of knowledge that you need in order to target those decision makers. And I know that we started being so innovative in a way that we need to, deliver that message. We also ask a lot. I mean, the younger generations, as they've been very, like easy when it comes to, digital world to actually to tell us how to, communicate certain message with a certain audiences. So it's really challenging, and it's also very important as I said, like this democratic side, like participatory decision making requires like the involvement of everyone, and the digital world also brings a lot of space, and it's also like that place where we can actually bring that, you know, identity, or actually we can speak more openly about the certain, topics or the needs that, and the risks that we are faced with. So it's still kind of the huge opportunity for everyone to participate, in order to change something.
Absolutely, and I like your link to social media and all of these things. Um, it's not a digression; it's just addition to it. Like for example, when you produce like a big report, scientific one, that you worked 1 year on all of this analysis, and then somebody comes and reduce this to like literally 5 words, and you're like, no, it cannot be done like this is too simplified. But no, we should put our egos aside, and okay, we have a lot of expertise behind us, so we can actually defend these 5 words. But we are going forward with these 5 words because these 5 words most people will understand and could relate to. So if we are saying you are dying out of air pollution, for example, I'm just blabbing, people will understand this. So, and they might identify as like, okay, yesterday I really had a bad cough and I have it for 10 days because it's so polluted outside. And like my neighbor is burning like really ugly stuff, really ugly thing is going out of his chimney and I can feel it in my lungs. Like this is so simple. So, and people can take it up on social media and create even more of identity, which we are speaking about, right?
Yeah, exactly. And as we're speaking for already 40 minutes, I just want to ask you one, I guess, a very important question is like, if there is something you really want to leave to us, like after this webinar, with like what would be like when it comes to policy making, and the challenges or all the lessons you learned to your experience when it comes to bringing this identities to decision making arena.
Policy making is definitely a fruitful field where you can make a lot of change. It's not always the easiest one, and like immediate fruits that you will pick out of it. So it might not be immediately that something will change, but eventually, especially if the roll starts, if the ball starts rolling, you can see big difference. Like so do not give up on this and do not discard this as something that is a little bit more on a paper. It's definitely not. It's really an action, local action brought up and scaled. So I would definitely be encouraging everybody to engage a certain level, at least, of policy making or policy like contribution to policy making.
Yeah, thank you. I mean, that's really important because you reminded me that it's also very important to engage with the local, like the community actions that we always have around, and it's very important to help those communities to bring that message to those in power. And I see that basically the digital places are do provide like the momentum of like joining different communities. Like you can really join that and talk to someone. And we have a lot of these small, like communities around the cities and around the countries, but basically I see that they started connecting to each other across the cities and across the countries. So it's very, very important to acknowledge that there is still a power when it comes to the citizens, and they really can, as you said, rolling the ball in order, like making that snowball effect in order to bring more people to that policy arena. And it's always like very important to say, how do you feel about the certain things that actually under the umbrella of this, how to say, like laws and bylaws and strategies and different topics. Good. Thank you very much for this discussions. I hope that everyone on the call has joined. So basically, I would like to open the floor for any questions or the comments or something that we missed to say, but it's important to say about it. Just be free to join, to step in, and to get the floor actually to say something or ask Vlatka
I
about.
would definitely invite everybody. Like I see some people, obviously I don't know them. I would like to hear from them. What did they come across, like specific identities that they realized and they used in their activities?
Yeah, sure. That would be very interesting. So is there anyone who wants to ask the question? No, actually, as Vlatka said, to share the experience they have like, working with a certain communities, or how actually your research work make you think about like how to deliver the message, or like, I don't know, to help certain community in order to deliver that message. Okay, Kiss. I see that no one actually is stepping in. So, yeah, I mean, I would like to really thank you for this conversation and for your time, and I really appreciate that. And I hope that everyone who joined the call has some insights that got from Vlatka and her experience in the policy arena. And really thank you for your time for joining the call.
Thank you. Are we still waiting for some brave?
Thank you very much. Yeah, I think we can still wait, but there's no questions, I
Brave
guess.
discussion.
Thank you, Vlatka, very much for your time today and for sharing your experiences. And yeah, thank you all, and see you next week then. Have a nice rest of the day.
Thank you.
Thank you so much. Bye-bye.
Bye.
Bye-bye.